Hey, so I got this new selfie stick. We're gonna try it and see how this goes. This is my 6-year-old Sky, our APHA mare, CP Chenille Rolex, that I've done some videos with and told you guys, she's wanting to get to her hay bag, told you guys that she's got ulcers going on and that we're gonna have to start treating for ulcers, and said that I'd talk to you more about that also. So this is me talking to you guys more about that. Just to give you a little bit of history with her, she used to be the sweetest thing in the world. And it's been like this ongoing mystery for probably the past 1.5 to 2 years. What the heck is going on for why she's so cranky? She's not the sweetest thing in the world anymore. And it kind of, let's see, what did we do? First we thought she's got the chiropractor. The chiropractor sees her regularly. She was doing the electromagnetic pulse therapy stuff, like massage, body work. So she got the soft tissue work, and I don't know, she just kind of, like even right now, like she kind of gets, here she's just licking me. I just fed everybody, but she will get nippy. She'll ear pin. She'll try to bite and kick at you, like with her, like reach her back leg up when you're saddling her. So chiropractor, the electropulse stuff, the soft tissue body work, that wasn't helping. My vet came out at the advice of the chiropractor. I had my vet out and she did x-rays for kissing spine. So I can talk to you more about what kissing spine is too, and if you've never heard of that. Then we did, so we did the x-rays for kissing spine. It wasn't kissing spine. And so then my vet said, you know, maybe it's poor saddle fit. So I pulled the saddle out and had her check the saddle fit. Saddle didn't fit. Well, guess what? I freaking bought that saddle brand new. I took Sky with me to the saddle shop and had the guy fit her and bought the saddle because he told me it fit her. It's a really nice roping saddle. It's like my favorite saddle, but nobody uses it right now because it doesn't fit anybody. So anyway, that saddle didn't fit. So Amy's like, oh, good. Amy's my vet. Amy said, oh, good. It's just saddle fit. Everything will be fine. Nikki, don't waste your money on ulcer meds or ulcer. I mean, she didn't say don't waste your money. She said, this is her words. She said, all horses have ulcers. It's just like the severity of how they're affecting them. And with my little mare, it was affecting her a lot. So anyway, so I thought I had the fix. I'm going to tie her here. I thought I had the fix. I was going to buy this new saddle, and I was so excited to buy a new saddle. I did really like mine, but who doesn't want to go saddle shopping? And everything was going to be fixed. So that was probably this time last year. So I bought the saddle, gave it a try for a while, and things were still bad. So anyway, then I had, just recently we did a saddle fitting clinic here at my barn, and the clinician palpated her ulcer spots, and the clinician is convinced that it's ulcers. And I could take her and I could scope her and see the severity of them, but I mean, it's good. I think that's just a waste of money. I'm sure that they're there. I just want to treat her, because treating for ulcers, if you've ever done it, it's expensive anyway. And I think if we go ahead and treat her, we'll see changes within the first few treatments and know we're on the right track. So anyway, I gave her first dose today. Before she gets too better, I thought I'd try to show you guys what I have noticed with her and what's showing us that she might have ulcers. So her head's down trying to eat in the ground right now, eat the hay that people have dropped, leftovers. Here, I'm gonna take, just like here at her withers, and I'm just gonna press a little bit there, get her to stop eating. And look at that face that we have. See that ears back, pity, I am mad, toss my head. That's just because I'm touching here on her withers. That was why the chiro thought maybe it was kissing spine. So if you don't know what kissing spine is, it's exactly what it sounds like. It's the vertebrae. She's mad because I was touching her still. It's the vertebrae kissing, like they're coming together instead of keeping an even space apart. and I'm not a vet. I mean, that's my simple explanation of it. So when we did the x-rays and there was even space between all of her vertebrae, I got super excited. My horse did not have kissing spine. She's just got ulcers. So anyway, as I touch her in the girth area, that's an ulcer point. So there's that mad mare face. She's trying to bite at my hand. Not happy about me touching the girth area. And now she's pawing over the girth area. Let's see. The clinician did like her flank area, and I think Sky knows better than to be rude to me, but she is pinning her ears very much like, oh, here she did kick up. See that? So she's not feeling good there, obviously. Let's check out her other side. Selfie stick's kind of cool. So we'll go to the girth area here again. I'm gonna just palpate the girth area, see her reaction. See that? I don't know if you could see, she did kick out her back leg. Don't kick my hand, please, Scott. See? So that's just like palpating. I don't know. Like I said, I'm not a vet, but to me, palpate just means I'm just taking 2 fingers and like pressing on it repeatedly. So she's not feeling good there. The flank again. I don't really know where the ulcer spot is here. It's funny, I've got my vet, oh, there's her face over it. And there she kicked out again. My equine vet's here all the time, and I don't ask these simple questions. And then I've got a really good friend who's a vet. She's here all the time too. So anyway, so that's how she's acting now. I'll kind of keep documenting with her ulcer treatments and let you guys know how she's doing. And hopefully she gets back to the sweet horse that she used to be. I was also gonna, I guess I could fill you in on how we're treating it. So omeprazole, the Ulcer Guard sells omeprazole is the drug. It's a tube-like wormer, and we're giving her a full tube a day for a month. And then I'm also treating her for hindgut ulcers. That's not as widely known about, but I'm like, we've been battling this for so long, I just wanna treat for everything and get it fixed. So hindgut ulcers, we're using sucralfate for that. And I think after everything's better, I'll talk with my vet and figure out like a good prevention. She's been on like the gastric care stuff for forever. People talk about Purina Outlast being good, and then MFA makes an Easy Keeper horse digestive care supplement. She's been on that stuff for forever, and it didn't guard against ulcers. For some of them, I'm sure it does just fine, but I think she's kind of a severe case. So some people will use sucralfate like if they're hauling or if they're showing. Some people will go ahead and use the Ulcer Guard with the omeprazole if they're hauling and showing. So after we get everything treated, I'll let you guys know what we decide to use for that. What else do we need to know? Oh, if you're gonna treat ulcers, do talk to your vet, because there are some guidelines about using omeprazole and sucralfate. And it's best used on an empty stomach, and you can't use them. You gotta like time between both doses. You can't give them at the same time kind of thing. Like, it's gonna kind of be a pain in the butt. My plan is we're giving the omeprazole in the morning on an empty stomach before she eats. Then we're gonna wait an hour before we feed her. Then let her belly get empty all day and give her the sucralfate about an hour before her evening feed. And we'll see how that does for her. So wish us luck. If you are into following the progress of my little mare and our 2 fillies over here, Annie and Oakley, and you're into following our Mustang adventures, we've got those 2 there, Leo and Benji, and you just want to see what life's like when you're managing 2 farms. Forever T Ranch does the equine stuff. Diamond H Ranch is where we have the Angus cattle. Like and subscribe. It's gonna be spring soon, and we're gonna have a lot of stuff going on outside. You guys are probably as sick of seeing this indoor arena as I am, and there's gonna be stuff going on outside and more stuff with the cattle once we get to spring. So subscribe to our videos so that you don't miss any of it. talk with you guys soon. Bye.